Your liver is truly one of the most fascinating organs in your body, a powerhouse that works tirelessly to keep you alive and well. Imagine this: 24 hours a day, 7 days a week, your liver is processing everything you consume. Every bite of food, every sip of drink, and even the air you breathe. But what makes the liver so incredible? Well, for starters, it performs over 500 vital functions every single day. These include breaking down toxins like alcohol and drugs to keep your body safe, producing bile to help digest fats, regulating cholesterol and glucose levels in your blood, storing essential vitamins and minerals such as vitamin A, D, E, K, and iron. Think of it as the body's ultimate multitasker and unsung hero. But here's the thing: even superheroes have their limits. In today's world, filled with sugary drinks, processed snacks, and increasingly sedentary lifestyles, our livers are under unprecedented pressure. What happens when the liver gets overwhelmed? It starts to store fat, leading to a condition known as fatty liver disease. This may sound harmless at first, but let me explain why it's a big deal. Fatty liver disease often progresses silently with little to no symptoms in the early stages. By the time most people notice something is wrong, significant damage may have already occurred. Shockingly, this condition now affects 1 in 4 people globally, making it one of the most widespread health challenges of our time. If left untreated, fatty liver disease can lead to inflammation. The liver becomes swollen and its cells are damaged. Fibrosis. Scar tissue starts to form, impairing liver function. Cirrhosis. Advanced scarring that can lead to liver failure or even cancer. But here's the good news: fatty liver disease is reversible in many cases, especially when caught early. And that's why this video is so important. Stick with me, because understanding your liver might just change the way you think about your health. Let's dive in. Section 1. What is fatty liver disease? Let's start with the basics. Fatty liver disease happens when your liver contains more than 5 to 10% of its weight in fat. There are 2 main types: alcoholic fatty liver disease, AFLD, caused by excessive alcohol consumption. Alcohol damages liver cells and interferes with the liver's ability to process fat. Non-alcoholic fatty liver disease, NAFLD. This occurs in people who drink little to no alcohol. Instead, it's driven by poor diet, obesity, and metabolic conditions like type 2 diabetes. NAFLD is now the most common cause of chronic liver disease worldwide. Here's a fact: it's so closely tied to modern lifestyles that some experts call it a lifestyle disease. What's alarming is that NAFLD can progress to non-alcoholic steatohepatitis, NASH, which involves inflammation and liver cell damage. From there, it can lead to scarring, fibrosis, and eventually cirrhosis or liver cancer. This progression underscores why early detection and intervention are critical. Science Corner. To understand fatty liver, let's look at how your liver handles fat. Your liver is like a factory. It processes the nutrients you consume, converts excess calories into fat, and either stores it or sends it out for energy. The problem starts when there's an imbalance: too many calories coming in and not enough being burned. Sugars and refined carbs, like those in sodas and pastries, are especially problematic because they're quickly converted into fat. Over time, this fat begins to accumulate in liver cells, interfering with their normal function. Here's an amazing fact: your liver filters about 1.5 liters of blood every minute, removing toxins and processing nutrients. But when it's overloaded with fat, its efficiency drops, affecting your overall health. Section 2. Risk factors and causes. Let's dive deeper into what makes some people more vulnerable to fatty liver disease. The condition doesn't just appear out of nowhere. It's often the result of several interconnected factors. Here are the most significant ones. 1. Diet. The biggest culprit. Diets high in sugar, refined carbohydrates, and unhealthy fats are like fuel to the fire when it comes to fatty liver. Why? Refined carbs, like those in white bread, pastries, and soda, cause blood sugar spikes. Your liver converts this excess sugar into fat, which can start to build up. Unhealthy fats, especially trans fats found in processed foods like chips and margarine, promote fat storage in the liver. Processed foods in particular are a major offender. They're loaded with hidden sugars, unhealthy oils, and preservatives, all of which burden the liver. Did you know 1 can of soda contains about 10 teaspoons of sugar, more than your liver can handle in one go? Over time, this leads to fat accumulation in liver cells. 2. Obesity, a heavy burden on the liver. Being overweight, particularly if you carry excess belly fat, is a significant risk factor for fatty liver disease. Why belly fat? Belly fat isn't just sitting there, it's metabolically active. It releases fatty acids and inflammatory signals that directly contribute to liver fat buildup. In fact, studies show that about 70% of obese individuals have some degree of fatty liver disease. But even modest weight loss, just 5 to 10% of your body weight, can significantly reduce liver fat. 3. Sedentary lifestyle, the silent contributor. A lack of physical activity is another major risk factor. Here's why. Exercise helps burn fat and improve your body's sensitivity to insulin. When you're sedentary, your metabolism slows and your body stores more fat, including in the liver. A 2021 study found that people who sat for more than 8 hours a day were significantly more likely to have fatty liver compared to those who incorporated regular physical activity. The good news? Even small amounts of movement, like a 20-minute walk, can reduce your risk. 4. Lean AFLD, the surprising exception. Here's an interesting fact. Even people with a normal body weight can develop fatty liver. This condition is known as lean NAFLD. 5. Poor dietary habits, even if they don't lead to visible weight gain. Insulin resistance, which can occur independently of body weight. Chronic stress or hormonal imbalances. Lean NAFLD reminds us that external appearance isn't always an indicator of internal health. That's why regular checkups and a balanced lifestyle are essential for everyone. So as you can see, fatty liver disease has many risk factors, some within your control, like diet and exercise, and others like genetics that aren't. The key takeaway? Awareness and lifestyle adjustments can significantly reduce your risk. Coming up, we'll talk about how to spot the early signs and what you can do to prevent this condition from progressing. Stay with us. Section 3, Symptoms and Diagnosis. Fatty liver disease is often called a silent disease, and for good reason. Most people don't notice any symptoms in the early stages. It's easy to see why this condition can go unnoticed. After all, the liver doesn't have nerve endings like other organs, so you won't feel pain directly in the liver itself. However, as the disease progresses, the signs start to appear. Let's explore what to watch out for. 1. Persistent fatigue, feeling unusually tired even after a full night's sleep. This happens because a fatty liver struggles to perform its normal detoxifying and energy-regulating functions. 2. Dull ache or discomfort in the upper right abdomen. This is where your liver is located. While it's not sharp pain, it can feel like a constant pressure or fullness. 3. Unexplained weight loss. A fatty liver may alter your metabolism, leading to unintended changes in body weight. In these advanced stages, fatty liver disease isn't just inconvenient, it's dangerous. Without proper intervention, it can lead to life-threatening complications like liver failure or liver cancer. How fatty liver disease is diagnosed. Because fatty liver disease often lacks clear symptoms, diagnosis relies on medical testing. Let's take a closer look at how doctors identify this condition. 1. Blood tests. The first step in diagnosing fatty liver is often a blood test. Elevated liver enzymes, particularly ALT, alanine aminotransferase, and AST, aspartate aminotransferase, can indicate liver inflammation. However, elevated liver enzymes alone don't confirm fatty liver, as they can be caused by other conditions. That's why further testing is usually needed. 2. Imaging tests. A window into your liver. Imaging tests are a non-invasive way to assess liver health. These include ultrasound. The most common test, it uses sound waves to detect fat deposits in the liver. CT scans and MRI. These provide more detailed images and can detect subtle changes in liver structure. FibroScan. This specialized ultrasound measures liver stiffness, which can indicate fibrosis or scarring. 3. Liver biopsy. the gold standard. In rare cases, doctors may recommend a liver biopsy, which involves taking a small tissue sample from the liver. This is the most accurate way to assess the severity of liver damage, including inflammation, fibrosis, or cirrhosis. While a biopsy is considered the gold standard, it's usually reserved for cases where imaging and blood tests don't provide a clear picture, or when the disease has progressed significantly. Section 4. Treatment and reversal. The great news about fatty liver disease is that it's often reversible, especially in its early stages. With the right lifestyle changes and a little determination, you can restore your liver's health and prevent serious complications. Let's explore how to take control of your liver health. 1. Adopt a healthy diet. Fuel your liver the right way. Your liver processes everything you eat, so giving it the right fuel is essential. Here's what to focus on. Whole, unprocessed foods. Fill your plate with fruits, vegetables, lean proteins, like chicken, fish and legumes, and whole grains. These foods are nutrient-dense and easy for your liver to process. Healthy fats. Include avocados, nuts, seeds, and olive oil in your diet. These fats are anti-inflammatory and promote overall health. Avoid sugary drinks and refined carbs. Beverages like soda and processed snacks like cookies or white bread spike blood sugar levels, forcing your liver to convert the excess into fat. Did you know that drinking 2 cups of black coffee daily may actually reduce liver fat and inflammation? Studies suggest that compounds in coffee, like caffeine and chlorogenic acid, can protect the liver from damage. 2. Exercise regularly. Move to improve. Physical activity is one of the most effective ways to reduce liver fat. Just 30 minutes of moderate exercise, like brisk walking, cycling, or swimming, 5 days a week can make a huge difference. Here's how exercise helps your liver. It improves your body's sensitivity to insulin, reducing the liver's fat load. It promotes fat burning and prevents further fat accumulation. For those new to exercise, start small. Even short walks after meals can boost your metabolism and support liver health. 3. Medical management. When lifestyle changes aren't enough, in more advanced cases of fatty liver, medications may be necessary to manage underlying conditions like high cholesterol, diabetes, or high blood pressure. While there's no specific drug approved for fatty liver itself, treatments for these conditions can indirectly improve liver health. Always consult your doctor for a personalized plan, especially if you have advanced liver damage like fibrosis or cirrhosis. Making these changes doesn't just benefit your liver, it improves your overall health, energy levels, and quality of life. Remember, your liver is incredibly resilient. By giving it the care it needs, you're setting yourself up for a healthier, longer life. Section 5. Prevention and long-term health. Prevention is always better than cure, especially when it comes to your liver, a resilient yet delicate organ that works tirelessly to keep you healthy. The best part? Your liver has an incredible ability to regenerate itself, so the steps you take today can make a profound difference tomorrow. Let's explore how to maintain long-term liver health and prevent fatty liver disease. 1. Maintain a balanced diet and active lifestyle. The foundation of liver health lies in your daily habits. A balanced diet and regular exercise can work wonders in keeping your liver in top shape. Balanced diet. Focus on nutrient-dense, whole foods such as leafy greens, colorful vegetables, lean proteins, and whole grains. Avoid highly processed foods, sugary snacks, and refined carbs that overload the liver with excess fat. Stay active. Incorporate at least 150 minutes of moderate physical activity each week. This could include brisk walking, swimming, or even gardening. Exercise not only burns calories but also improves your insulin sensitivity, which reduces liver fat accumulation. 2. Get regular checkups. Routine health screenings are crucial, especially if you have risk factors like obesity, diabetes, or a sedentary lifestyle. Blood tests to monitor liver enzymes such as ALT, alanine aminotransferase, and AST, aspartate aminotransferase, can help catch early signs of liver stress before it progresses. If you're at a higher risk, ask your doctor about imaging tests like an ultrasound or FibroScan to get a clearer picture of your liver health. 3. Prioritize gut health. Your gut and liver are closely connected through the gut-liver axis. A healthy gut microbiome, your collection of beneficial gut bacteria, helps reduce inflammation and supports the liver's detoxifying functions. To keep your gut thriving, eat fiber-rich foods like oats, beans, broccoli, and apples. Fiber feeds good bacteria and promotes healthy digestion. Incorporate fermented foods like yogurt, kefir, sauerkraut, and kimchi. These are natural sources of probiotics that enhance gut health. Avoid excessive use of antibiotics, as they can disrupt the balance of your gut microbiome. Your liver is one of the hardest working organs in your body, but it also relies on you to take care of it. By adopting these preventative measures, you can protect your liver for the long haul and enjoy better overall health. And there you have it, a comprehensive guide to understanding and reversing fatty liver disease. With the right steps, you can protect one of the most vital organs in your body. If you found this video helpful, don't forget to give it a thumbs up and share it with someone who could benefit from these tips. Hit the subscribe button and turn on notifications so you never miss out on more health insights. And stay connected with us for daily health tips, recipes, and inspiration. Thanks for watching. Remember, your liver is your body's superhero. Let's give it the care it deserves. See you next time.